Hey, good afternoon, everyone. Welcome to a special session brought to you by your union, ACFO, the Association of Canadian Financial Officers. My name is Danny Richard. Very happy to serve you as ACFO president. We've got a great session today to discuss the Public Service Healthcare Plan. Public Service Healthcare Plan. This session will be in English, about 45 minutes. We've done a lot of work on this plan, friends. It took many years, and obviously a lot of people are involved, one of which is Stephanie. She's here with us today. So on va dire bonjour. Bonjour, Stéphanie Rochon-Perra.
Hi, everyone. So I'm Director of Job Evaluation and Equity at ACFO, and I'm happy to be here.
So what we'll be doing here in the next 45 minutes, friends, we're going to be going through maybe the highlights of the plan, tell you how it works. But we also want to give you an opportunity to ask questions because we know there's a lot of questions on this plan. So the way you can interact with us will be through Slido. You know us. We love Slido. It works well. If you go on slido.com, you can see on your screen right now there's a QR code. You can scan that QR code, or you go to slido.com. ACFO-ACAF is the code word you put in there. ACFO-ACAF. You can vote the questions up. What I do recommend, colleagues, is perhaps wait towards the later parts of the presentation, because if you do have some questions, some of them might be answered by Stephanie during the presentation. But we'll come back to Slido towards the end, maybe around noonish. Eastern time, hopefully, depending how long it takes. So what I want to do to start to kick this off is, the Public Service Healthcare Plan is the biggest plan in Canada. It affects not only you as public servants, all the public servants, the retirees and their dependents, about 1.5 million people. And the plan itself had not been updated in over 15 years. This was long overdue. It takes a long time to update this because there's so many people involved. This is not just negotiated for you, but everyone. So that being said, it took a while to do that. Maybe Stephanie, I'll toss it over to you. You can walk us through how it works, the plan itself, the improvements, what it is. So Stephanie, over to you.
Thank you, Danny. So maybe we'll go to the table of content over the next slide, just to give you a taste of what we're going to be covering today. So if we can go to the next slide. Thank you, folks. We're getting help from Rex and Andrew, our communication team today. They're working in the background to support us during the course of the presentation. So here we are. We're talking about ACFO's role, how we got here, the plan change highlights, and what's next. So the first step, we'll go to ACFO's role. And basically, maybe just before we start with that, I should probably mention that the parameters and procedures are still in development by Treasury Board, the Administrative Authority, and Canada Life, and they're actually working on preparing guides and information bulletins on the changes. So the sessions of the purpose of the session today is really provide a general overview and information on improvements of the plan changes. So it's not intended to provide specific advice or specific details on like a list of drug coverage or specific treatment coverage. And I do, as the presentation unfolds, I do want to give a shout out to my counterpart at PIPS, Colby Briggs, who for his support and information sharing in the presentation, in the preparation of the presentation today. So ACFO's role in the improvements and changes to the plan. It's important to know that ACFO and other bargaining unit agents are not part, it's not part of a collective bargaining process or collective bargaining negotiations, the plan changes. So the benefits are not negotiable under the Federal Public Service Labor legislation, and Treasury Board has adopted a consultative forum to review the plan on a cyclical basis. So ACFO participates through that consultation committee and that consultation process. And so we're happy to keep members informed with the information that we have and that we've gathered, but we're not involved in the administration or the implementation of the plan itself. So that a little bit more about our role is that what we do, we really advocate to provide recommendations on the plan changes. We're engaged in communication to employees. So once we get access to communication or elements, we share it with the membership as much as possible so that you can stay informed. We try to guide members on their rights and obligations and the appeal process for the plan coverage. What we don't do is process claims or access your public service healthcare plan file itself. We don't have access to any of that content. We can't provide information on benefit coverage other than some of the general information and the parameters of the plan. And we don't make changes to the plan itself as well. So I've included a 1-800 number as well and contact for Sun Life and Canada Life just below in the slide. So you can always contact the Public Service Healthcare Plan call center as well if you've got more specific details or more need information more specific to your situation. So how do we get here, which is the next component of the presentation. So this is an employer paid plan for current and retired employees and their families that are working in the core public administration and most agencies. And so current employees don't pay a contribution for the health benefits. So the cost is really solely paid by Treasury Board, unless employees opt for additional, like for example, hospital coverage. For example, going from a private room rather than in a shared room, for example, you can pay an additional premium for that. Retirees do pay contribution as part of a shared cost, and some employees that are on leave without pay situations as well might have to pay the employee and the employer portion. So just depending on the type of duration as well and the type of leave without pay. The plan itself is made to cover health expenses that are not insured by your provincial healthcare plan. So it's really made as an additional complement to what you already have access to under the provincial plans. It's not made to replace the provincial coverages. So what happened is that on October 3rd of 2022, which I'm sure many of you heard the news, is that the Partners Committee of the Public Service Healthcare Plan issued a joint recommendation to Treasury Board proposing an overhaul of the plan's benefit coverage. So the plan updates also through this recommendation. How did we arrive to that recommendation? It's based on member feedback, including by way of a survey that was conducted in November of 2017, so some time ago. That's how long this negotiation took for us to get here. We also had member inquiries, appeal cases, data on usage, demographics of the plan, GBA plus data that was used, benchmarking with comparable private and public sector plans as well was used. So that's a bit of a summary of how we got there in terms of what was considered. While there is a consultative process, technically, given that it's solely paid by the employer and it's a sponsored employer plan, Treasury Board was really in the driver's seat on these changes. And so it's important to kind of note that in terms of it not being negotiable under the law. In terms of history as well, I just want to mention a little bit more that drug coverage and physiotherapy were big cost drivers for the past 10, 15 years. And our plan was sort of, if you think of a balancing scale, was very heavy towards drug cost, medication cost. It has skyrocketed over the last 15 years on physiotherapy. And one of the objectives that Treasury Board is looking to do is get a bit more balance and balancing it to the various benefits and the needs within the plan. And so the plan was very generous on medical coverage. And so there had to be some new ways and efficient ways to be able to find ways to save or to maximize your dollar under the plan. So another goal that Treasury Board had communicated to us is that financial sustainability as well was really important for the employer. So we started negotiations consultation in 2018 on or about, and Treasury Board President gave the mandate of 50% gain sharing ratio. So that's basically a cost negative mandate that we started with in 2018. So I think it's important to understand where we've been with that, because it took several years for us to get the employer to change its mandate to cost neutrality, which is where we got here in 2022. And again, Treasury Board's the driver in the seat here. This is not subject to collective bargaining. So it took quite a few years for us to get them to pivot for their original position. So this explains some of the delays that we've experienced in these negotiations, or I say negotiations, consultations. And we also had an independent progressive consultants that reviewed the plan. They told us the plan wasted a lot of money on inflated drug costs, excessive pharmacy fees. We were also made aware of fraud cases in our plan, particularly in physiotherapy, where changes were needed. So we realized that in order to make our plan more equitable to all the types of users, we needed to pivot and to make some material changes in the plan. All right, so I think I'm going to go ahead and dive right into some of the new benefits. All right, here we go. I'm not going to go through each benefit and change, but I'm going to highlight a couple. And all of this information is available on the Treasury Board website as well in terms of changes. We've also got the ACFO website where we provided updates in terms of the charts and breakdown of the increase in benefits. So I'm going to start with injectable lubricants for joint pain and arthritis. So this is a new benefit, and it's a special treatment. For example, viscosupplementation or other types of lubricant for cartilage, for example, is something that helps reduce pain for long-term relief. So that's something that has also helped a lot of our members regain some of the mobility that they've lost. So that's a new benefit coverage that we have in the plan. We've also got gender affirmation, and a lot of members have told us that equity inclusion is very important to them, and I'm very proud to be part of this of the technical committee who helped in terms of bringing forward this new benefit for our transgender health. It's a big win for our transgender members, and it's one benefit that's doesn't cost a whole lot. While it's $75,000 for a lifetime, it's a very small amount given the limited amount of people that use it, but it makes a big difference in the health of those who do need it. And so it's specific on the specific details of what's going to be covered is still to be determined. That's something that Treasury Board and Canada Life will provide information on. So I don't have additional information to share with you today in terms of the specific details of what is going to be covered under that umbrella. Mental health increase of $3,000. So we're going from $2,000 to $5,000. And so we've got also an expansion of the providers that are covered in here, so such as social worker, registered counselors, and psychotherapists. So there's no prescription that's required as well. So that's an important change that breaks down some of the barriers to access mental health care. So I think it's a big win for employees, and there's a lot more information that's coming on the actual list of providers that are now going to be covered under this benefit. So physiotherapy, just going back a little bit more because this is a major change as well that I wanted to make sure that we spoke about. And actually, do we have it on the list here? I think that might be the next slide. There we go. So physiotherapy, this is one of the harder items that we looked at. And under the current model, you get 80% coverage for treatment for the first $500 a year, and then zero coverage between $5,000 and anything less than $1,000. It's known as what we call the corridor. And thereafter, you get unlimited physio coverage at 80%. So that's the current status quo model that we have. And it was not a good model because members were stopping treatment. What we saw in some of our usage is a lot of members were stopping usage once they reached the $500. And the feedback that we got was inability to pay in a lot of cases. So this was concerning. It was a gap that we did have that we needed to close in our plan. And there were also a number of fraud and suspicious billing cases in claims that resulted in unlimited benefits. So looking at our plan demographics and usage and the data analytics that a consulting firm reported to us that there was unexpectedly very high usage of members using physiotherapy when we compared with other plans. So that suggested that there was an overusage or overtreatment of conditions. And so in that situation, there was a need to address this in the plan given the circumstances and the high cost of this benefit that was to the detriment of other benefits in the plan. And so maintaining the current physio benefit was not sustainable from the employer's perspective. And it brought this benefit, there was a need to bring this benefit in line with other benchmarks. And unlimited physiotherapy was basically unheard of in the industry, and it came at a very, very high cost. And so this was a priority that Treasury Board had and moving this along and making some changes in that respect. It wasn't an easy decision, even for us on the technical committee, but we know that because there's a lot of our members that have challenges with the new cap. And so what's helpful is that the plan does offer other new benefits that can complement the physiotherapy and provide new ways to take a preventative approach to your health. And on a last note on the physiotherapy and reviewing the data, we did realize that a lot of conditions were being treated through physiotherapy when they can be treated through public health care system. So most of the provinces have some coverage in physiotherapy for certain chronic conditions and acute conditions, such as rehabilitation programs. So members should be speaking to their health professional to find out about what options that they have that's available to them as well. Electrolysis, so that's something that there's no prescription that's needed, another new change for gender affirmation. We've also got some increases with respect to, and I think that's on the next slide, if we can go to the next one, in terms of glasses and contacts coverage, eye vision care. And it's a very expensive benefit. It doesn't look like a huge increase in terms of the amounts for the prescription and the laser eye surgery. It is for the laser eye, for example, going from $1,000 to $2,000. Some members want to say, well, that doesn't cover, the full laser eye surgery. And so there's still some gaps there in terms of being able to afford full coverage. But keep in mind, for every dollar that's added, it's a very large expense because there's just so many people on the plan that need eyeglasses, for example. So it's a very, very high usage number. So I think I'm going to go to the next slide on the increase in benefits, specifically for. All right, well, let me just talk to you very briefly, though, about the hospital coverage. There's a difference in the levels. We've had some increases for members who do opt to have additional coverage for their hospital stay. So mentioning that if you want a private room instead of a shared room, it does come at additional coverage to you. So we've increased the hospital coverage by $30 for daily hospital stay. There's also the travel emergency benefit that's doubled, gone up to $1 million. So that's been some movement that we've been able to achieve. All right, and in terms of the changes, oh, there we go. So now we're going to go to the changes slide. So that's a good summary of the increase in benefits. Thank you. So we'll go to the changes. And we'll talk about the mandatory generic drug substitution and also the prior authorization and compounding drugs. Maybe first, currently the plan rules, it doesn't have a lot of rules around drug benefit. And so this means everyone who claims medication at any cost is by default approved. So right now, if you have a physician that prescribes a medication that's $100,000 a month for a drug, it's automatically covered. The cost of the medication has exploded in the last 10, 15 years, and it's a huge cost to the plan. Pharmaceutical companies are charging a lot more, significantly more for drugs, and there's very limited regulations in Canada on pricing of medication. And so the public service healthcare plan is paying a lot more for medication. A generic brand, for example. So the current plan has mandatory generics, but employees can opt for no substitution, no questions asked, if they opt for no substitution. So our plan has a really high usage of brand name drugs in comparison to other plans, and we have obtained studies confirming this. So in the new plan, the administrator is going to ask, the change there is that the administrator is going to ask you and your physician why you can't have the generic. So instead of it being automatic, if you say no substitution, there will be a follow-up asking why can't you have the generic. If you have an allergy, if you have a medical condition that doesn't allow for a generic, that shouldn't be an issue. It's really, if it's based on personal preference, then you'll have to cover the difference in the cost for the brand name. When a plan uses a significant amount of money on medication, that means that there's less money that's left over to spend on other types of health benefits. And so this is part of some of the overhaul changes in trying to make the plan more affordable and rebalance some of the health benefits in the plan. So that's why I want to talk to you a little bit more about the prior authorization program. And that's really in cases where there's a high cost drug that's being used. So we talked about, let's say it's $50,000 a month for a specific drug. And there are some of those drugs out there. And so instead of being automatically approved, it's going to be pre-approved. And there's going to be a specific range of drugs and a list of drugs that's currently being developed. And so we know that members are really anxious about the implementation of the prior authorization program, and there's going to be some growing pains as it gets rolled out. What I can tell you is that we have gone through this with our members at NAF Canada who have a prior authorization program, and it is working well. But it's not perfect, especially when we're transitioning in from using these high drugs, and you've got this introduction of a new prior authorizing program. So the unions advocated for grandparenting protections to be granted for members who are on these prescribed drugs already, and that if there's a list of the prior authorization program in July of 2023, and your drug is on that list, but you've been on it before, there's a grandparenting protections for those individuals. There are maybe some case-by-case situations where members need to switch to existing biological drug to a biosimilar under the new plan, but that's really something that we're keeping an eye on in the event that something happens. It's really going to be on a case-by-case basis, and that's something that you're going to get reached in communication by Canada Life to talk about whether a biosimilar is possible. And so biologics are really meant to treat chronic conditions, for example, cancel treatment, and they can be very high cost. But they are meant to treat serious conditions. And so this is why we're keeping a close eye on this to make sure that members are protected and they do fall under the grandparenting provisions. And changes to biosimilars is really meant to occur in cases where it's medically appropriate to do so. And it's not going to be automatic. It's not supposed to be automatic across the board starting on July 1st, 2023. So there's going to be an implementation process. There's going to be discussions and consultation process as well throughout this implementation. All right. So moving on. And just to mention as well that the protocols are under development. So there's going to be more information that's coming. There's also going to be grace periods as well through these transitions and the implementation period. Catastrophic drug coverage. That's the limit was increased from 3,000 to 3,500. So that's the first increase since 2006. I just wanted to note it. It's been such a long time. We really, really needed to do an overhaul and increases to our plan. And on the pharmacy dispensing fees, there is a fee cap. It doesn't apply to biologic or compound drugs. I just want to put it out. That's a question that we're getting a lot because those fees are a lot more than and would definitely not be covered in $8. So the frequency limit for maintenance drug, members are expected to optimize and save on dispensing fees by getting enough medication for 3 months rather than going to get a refill every single month. So if you've got a maintenance drug, that's something that you're expected to get your prescription in bulk to save on the dispensing fees that are being charged by your pharmacy. And so this change is about changing user behavior to save on fees to refill medication. So there are expectations, for example, when you use your copay and it's more than $100 or something like that, it's common sense exemptions that can apply as well. But overall, you need to make sure that you're going to the pharmacies where you've got pharmacies like Shoppers Drug Mart that are charging a lot more than $8. So you may need to shop around and find discount change, and also clubs like Costco, for example. And there's also mail order pharmacies as well. I'm talking a lot, folks, and I'm saying a lot of information, so I hope that you're following along. We do only have 30 minutes, so I am sort of doing a marathon on the public service healthcare plan changes. But maybe also an important note that I didn't want to forget to notice is our Quebec members. Quebec has a legislation on dispensing fees, on markup fees, on dispensing fee frequencies. My understanding is that the cap limit won't apply to members in Quebec, but more details are going to follow from Treasury Board and Canada Life on this, but that's my understanding at this point. All right, so Service Plus. Just reminding folks that you do have access to your Service Plus program. And so this is accessible to all of our CT members. And so if you don't have access or you haven't registered, please do get your ACFO membership account and get to Service Plus website and enter that, because there are discounts. So for example, MedNow online pharmacy, they do offer a benefit of 10% discount on drugs. And so they're starting this actually this month, and I'm not sure if they've rolled it out. It was my understanding they're coming out. If it's not this week, it's in the coming weeks this month. So this is also an option for you in terms of when you talk about the coverage for the dispensing fee to make sure that you're not paying anything out of pocket that's above $8. All right, so I think that brings us to the end of our presentation. I think that brings us to our, oh yes, that's what's next. Sorry about that, folks. So Treasury Board and the Administrative Authority is going to circulate more information. And so you can expect to get some additional information from your employer. It's not ACFO that's managing this. We're trying to just gather as much information as we can to share it with you so that you can be more prepared for the change that's coming. And we all are also working with the employers that we need more communication. We need to make sure it's seamless transition over for the employees. But our understanding is that you'll get information from Canada Life to make sure that everything gets transferred over. You do want to make sure to complete the positive enrollment with the Canada Life system. So as soon as you get some information to go on and join the new Canada Life portal, so just make sure that you're keeping track of the communication, you're staying apprised of some of those developments, and you're doing what you need to do on your end to make sure that it gets activated. Also, as a word of caution, because Sun Life is the provider until June 30th, 2023, make sure that you submit all of your claims up to that date to that insurance provider. Very important. It is going to be Canada Life going forward after July 2023, but because we're going from providers, be cautious. Make sure you submit all of your claims that are for before June, from January to June 30th, 2023 with Sun Life, and that you submit everything with Canada Life after July 1st, 2023. We don't want to have members that are stuck in limbo between insurance providers. I don't think that's the case. I know Treasury Board is working really hard to work with the different providers, but as a word of caution, that would be something that I would recommend members doing to make sure they don't get caught in between insurance providers. All right, next slide. All right, questions. So just again, just a quick reminder as we get into the questions. So the plan, rules, and procedure are still in development by Treasury Board, the Administrative Authority, and Canada Life. We're actively working to prepare these guides and information bulletin on the changes. I will answer, and Danny and I will both answer some of the questions as best as we can, as best of our abilities, in terms of the information that we do have. It doesn't serve as a confirmation. I know a formal confirmation. It's our understanding based on the information that we've been provided, and we're trying to communicate that information to provide guidance to you in terms of what you can expect, what's coming.
Hey, thanks a lot, Stephanie. That was a lot of information in a short amount of time, but really appreciate you condensing it down. Friends, we've got a lot of questions on Slido, as we expected. We have over 500 people who are online with some questions. So I'll tell you what, I'll let Stephanie have a breather here. I'll maybe add a couple of things. The public service healthcare plan is one of the most complex plans to negotiate because unlike your collective agreement, okay, your collective agreement, we always ask you guys, what is it you would like to see improved? And there's a unanimous response in agreement in terms of what's most important. It's always wages, leave, and in this round was flexible work arrangements, right? It's always the same. However, the public service healthcare plan is different. It's very personal. If you're someone that's 25, 35, 40, 55, 60, 85, because remember, the plan follows you even when you're retired, your needs will change and evolve. So this is why it becomes very personal when we look at hundreds and hundreds of requests from members. And I'll tell you, we did this in 2017. And it's difficult because if only one person requests something, well, should we leave it aside? No, because maybe with that one person, it's tens of thousands of dollars. Whereas something like eyeglasses, maybe it impacts a lot of people, but it's a lot more costly because there's more volume, right? So it's very challenging. So I'll tell you, we're very happy that ACFO at least is at the table because out of the 19 unions, only 3 are at that bargaining table or consultation table. There's us and the 2 other biggest unions. So we're very proud to be able to at least represent us and other unions to ensure that we try as much as possible not to leave anyone behind. So if you want to have a full list of what Stephanie did, I saw the question on there. Yes, we will have this video on our website. We can put the deck on there, but the changes are already on our website right now. If you go on ACFO, on top, you click on the search and you put in the PSHCP, Public Service Healthcare Plan. You can see a post in August of last year, and we go through all those changes. So that's there. One last thing before we start taking the questions on Slido. One of the good things we got on this plan is that we also have an agreement to review it in a couple of years. I think it's in 4 years to do some incremental wins, right? So that's something we believe at ICFO is you don't get big wins in every round. You do incremental wins. And when you add up all those wins, that's where really you start to see the progress. We're really proud of that we won't need to wait another 15 years to go back and renegotiate this plan because that's really what we're trying to do is get those incremental wins. Okay, let's go to Slido right now. Slido.com. If you have questions, try to not ask the specific questions, friends. And I know you have questions. The way I say this is Treasury Board is coming up with an FAQ to answer all your questions. We're trying to give you the highlights like we did. We'll happy to take questions at a high level. You vote them up, friends. We're going to take them as they come. Vote them up. All right, Stephanie, first question that I see here. If I use my benefits under the current plan before implementation in July, will my coverage reset after implementation?
No, so the plan is still the same. It's just with new limits and a new administrator. So the policies and limits that are in place on the day and expenses incurred will remain in effect. So for example, if you've got massage therapy expense that you incur prior to July 1st, you'll be eligible for the $300, which is a current limit at an 80% reimbursement, of course, because all of the benefits are at 80%. But on July 1st, you'll have that additional $200 to spend in that calendar year. So it works by calendar year, as you know, from January to December. And so you're not going to be able to submit. Let's say that you spend that $500 before July 1st. You say, okay, well, I got reimbursed $300. I got that extra $200. I'm going to just claim it after July 1st. No, the services have to be incurred on a go forward basis after July 1st for you to submit a claim for coverage for that period.
Thanks for that, Stephanie. Actually, I just want to point out that this, I like where you guys are coming at, because this is actually a question we asked as well, because we thought because maybe it's a new plan provider, it resets everything, but it doesn't, right? It's the same plan, just a new provider as well.
And maybe the next question, I think I answered it, but it's 80% of the max, absolutely. So if you gave the example of physiotherapy, but that is correct. So it's always 80% of whatever the amounts, the maximum amounts are as they are identified there in the table in the presentation that we went through.
Next question we had was, will the presentation materials be made available on ACFO website? Yes, the benefits themselves are already on there, but we would happily post the deck that Stephanie shared, and we can actually put this video as well, because I know we went through a couple of those quickly. So yeah, we'll make sure we post that on our website. Next one, just want to say thank you for the hard work. I'm sure this was a very tough assignment, and it takes a lot to keep benefits equitable. You know what? Thanks, friends. I'll tell you what, I sit in the partners committee. Stephanie's on the renewal committee. But we work with the other bargaining agents, but also thank you to providing your feedback, right? Keep in mind, ACFO is there to represent our members, but our proposals are only as good as the feedback that we get from our members. So thank you for filling out our surveys and letting us know what are the things you want to see improved on. That's so important, because at the end of the day, we're there to represent you. Next question, for the amounts in slide 6, for example, massage therapist, is the coverage 100% for the first 500, or is some percentage such as 50? Oh, I think you actually answered this one, Stephanie, right? It's 80%.
80%.
Yeah, thank you. Are benefits now coming to be under one provider for both health and medical and dental? If so, great improvement, as currently messy to have 2 providers.
We still have 2 providers. Sorry, folks. I wish I had better news for you, but it's a separate plan. I think it's Great West Life right now. And that's currently, I believe the parties are trying to do a renewal of that plan right now as we speak.
Yeah, the dental, I saw we had a lot of questions on dental, so we'll just skip those, because the dental is not part of the healthcare plan. It's a separate plan. I completely agree with you. It seems like it would make sense to have it under one provider, to have more of those holistic approach. This is the next step right now. That's why it was good for us to reach this agreement on the healthcare plan. So the next step now is the dental, and I can assure you ACFO is involved with that as well. So that's good news. But no, it's not under the same plan. It's 2 plans for now. Next one's, why you didn't recommend to TBS to create a pool of money for each employee for healthcare benefits that could be used based on each member's needs. Of course, we get this one a lot. Stephanie, why not?
Yeah, part of the reason is that in terms of viability of the financial cost of the plan, it's costed in a way that some people don't use the benefits, right? Not everybody uses the maximum amount of benefits. And if you have this kind of pooling of money that members can use, then the usage and the cost of the plan would increase considerably. So it's just not viable. Treasury Board wasn't prepared to entertain that proposition in terms of the pooling of the money, because it would be a lot more expensive. And so the usage would increase.
It's a great, I like how you guys are thinking, right? Because you're looking at it from, well, it seems like it would make more sense. And you're right, it makes more sense from the user's standpoint. But from the employer standpoint, the cost analysis is completely different. As Stephanie pointed out, if the employer were to say, everyone gets, for example, I'm just going to throw a number out there, $10,000, you use it for whatever you want. Well, obviously, more people will be using that amount, which is great, right? You have a healthcare plan. You want to make sure people can use it, but someone's got to pay for that. And right now, it's all the employers. So for the costing for them goes significantly higher when it's a pool of money. But I like where your head's at, though. I like that. We get that question every time. Stephanie, the reimbursement at lowest cost option instead of actual paid concerns me. Will the prescription doctors know the various prices to determine the prescription?
In terms of the lowest cost option, I think you're probably referring to the cap of the $8, I'm assuming. So that's really, it's become more and more industry standards, the $8 cap, and various pharmacies will charge various different prices. So it's important when you go to your pharmacy or you shop around to make sure that you're aware. Like Shoppers Drug Mart, for example, would be an example. Maybe I think it's about $12 now. So you need to be aware that you'll be out of pocket that amount of money. So in terms of will the prescribing doctor know the various prices to determine the prescription? Probably not. I'm assuming. So that's really something that you need to talk with your pharmacist about in terms of the cost of that medication, in terms of the dispensing fee.
Thanks, Stephanie. Next one. Wow, prescription. I want to make sure I capture the mood here. Wow, prescription no longer required for physiotherapy and massages. This is great since my doctor was charging me $25 for each prescription. Yes, you're right. I mean, again, this was a barrier. At the end of the day, you want us to be as frictionless as possible. But again, keep in mind, the less barriers there are, the more the usage goes up. So there was a cost to this. The simple fact that you need to get a doctor's note for a massage or physio, less people use the plan. So when the employer wishes for them to remove that, which we all agree doesn't make any sense. You should need a doctor's note for this. Even your doctor's like, why do you come for me? Well, I need it for my plan. But then more people are going to use it. So the cost goes up. But yes, no longer required now. Next one, will dental coverage be better? Currently, there are issues with having crowns covered under the plan. Yes, like I said, the dental plan is something we're looking at next. And actually, Rex, the dental questions, maybe we can park those for now because we can't answer any of the dental ones. But I agree with what you're saying. The dental plan needs to be reviewed, and that's what we're looking at right now. And your next question might be, well, Danny, when is it going to take an effect? Guys, we don't know. I'll tell you this, though. Dental is less complex than the healthcare plan because generally speaking, dental procedures tend to be similar. It's less variety in dental than there is for healthcare. Next one, is the coverage for braces increasing? We'll have to see once we negotiate the plan. How will the transition going from Sun Life to Canada Life look like? Any thoughts on that one, Stephanie, and transition?
Well, that's what we're trying to get to know from the employer. We're really trying to get those booklets, those guides, there's procedures that are in place, because even for us, as bargaining agents, I don't know that we've got all that information at this point in terms of we're not part of those, we're not at the table in terms of those conversations with the insurance providers. So more information to come on that, especially there's the Public Service Healthcare Administrative Authority website. They provide updates to members. So I know they've released a couple of new communication pieces, so it's worth to go take a look and take a read and to just stay apprised of developments there and the communication on their website.
Stephanie, you know what's hard for us is, like, I get where the questions are coming from, right? But for ACFO, we're not the one issuing the contract. We don't do the tendering. We're not the one discussing with Sun Life and Canada Life. Like, we want to give you as much information as we can, but we're kind of handcuffed because the only information we really have is either on the website or through our connections at TBS. But we understand that you guys want to know the details, specifically when I'll go with the next question here about eyeglasses, right? Well, how do I qualify? So the question is, I heard glasses increases to $600 July 1st. It's not the case. I already was reimbursed $250 this year. Can I get more glasses contacts in July and have the extra costs reimbursed? Stephanie.
That's a really good one. Okay, so the current vision benefit that runs for the 2-year period, right? So from January 1st, 2023 to December 31st, 2024. So the current maximum allowance for vision care is $275. That maximum increases to $400, unless I've got my number wrong, but I'm pretty sure it was $400 as of July 2023. So from July 1st, 2023 to June 30th, 2023, the plan participant, you can claim the $275 towards the glasses or the contact lenses. But if you claim the maximum amount for the $275, then you're capped for the next 2 years. If you spend only $200, and then after you've got that leftover $75, let's say after July 1st, 2023, then you can utilize and have access to that unused sum of $75 plus the additional increase to $400 in terms of benefit from July 21st, 2023 to December 31st, 2024. So I hope that kind of covers it a little bit more in terms of detail, but you definitely need to be careful. If you maximize your $275 before July 2023, My understanding, and I've been following up with the Treasury Board to get confirmation on this, but it looks like the way things are lining up in terms of the interpretation, once you maximize your vision coverage, you're maxed out for 2 years. So if you max it out at 275 before July 2023, so you're not going to have access to the extras after July, because the way it works is you max out, it's for 2 years. So you need to be careful in terms of the timing, especially for the vision coverage. So it's a little bit trickier, and I'm in the process of trying to get a confirmation, especially on the vision care, to confirm that members, once they maximize that benefit, let's say that 275, whether they will be eligible for the difference if there's no unused benefits that are being ruled over after July 2023. So more to come on that, and that's a really important question. And I think there needs to be clarity from the employer and from the administrative authority on this.
And I think, friends, this is why it's so important that the employer provide us with not only the details, but examples as well. This is a very relevant question, right? You want to know, am I being penalized here? Should I max out? Whereas if I wait a couple of months, because we're talking about hundreds of dollars here, right? So you want to know, hey, what's the best strategy to be applied? And to be honest with you, the employer should have this by now. But I think their main focus is getting the transition over from Sun Life to Canada Life, and even the implementation date of July 1st. Like, the clock's ticking, right? This is a couple of months away here, and this is the biggest plan in Canada. So hopefully they can provide you that information.
And maybe just to specify on that as well, unused and partially unused benefit amounts for individual services can be transferred over to the second part. So after July 2023, but if there's no unused amount, that's the part where after July 2020, will members be able to access that additional if they've maxed out already? Because the way the plan works right now is once you maximize on that, then for the next year, you've maximized your benefit on that. So I know that for unused and partially unused benefit amounts, you'll be able to use them after July 2023 in addition to the additional increases.
Next question is, do we need to provide new membership number to our pharmacy, or everything would carry over? Stephanie, we don't have the answer to this one, right? Unfortunately, we don't know. I would assume you'll probably need to provide your new number. I'm not sure how your pharmacy would know what your new number is. You would assume it's seamless, but knowing the government, I don't think that'll work that way. I think you'll need to provide it. But again, we don't have the answer to that one. A couple more. What was the cost for ACFO members to have the new gender affirmation coverage, and what percentage of our members does that apply for? Fortunately, we don't have access to that data, right, Stephanie? When we do the healthcare plan, it's not just for ACFO, it's for everyone, 1.5 million people. And I don't think we have that data for ACFO. They don't provide that, right?
No, we don't have it for ACFO, and also, but we did have some GBA Plus data that just overall of the plan that was used. And we anticipate that it's going to be a small amount of employees overall, not just for ACFO, that are going to be using this coverage to a maximum of 75 for a lifetime. But we don't actually know how many ACFO users will be having access to that gender affirmation coverage. I think that's still to be determined in the future. Once we have access to the coverage, then we'll have more demographics in terms of how many people are using it. But again, it's always general numbers for all of the employees, not specific to bargaining agent.
Next question, is the electrolysis benefit available for non-gender affirmation purposes?
Yes, it is. And I believe there is a prescription requirement to access that benefit, but it is available.
We have a comment here. Sometimes pharmacies won't allow us to get 3 months at a time. That's true. And again, pharmacy shopping, right? It's funny how pharmacists are different. The fees, how much they give out. You're right. There might be some strategy need to be used there. And
it depends on the type of medication as well. Sometimes you can't get medication for a 3-month period. Either it'll expire or it's a sensitive type of medication. So just depending on the situation. But that's a good point.
Stephanie, we'll do one more here. Generic substitution, what is the process to get approval to remain brand name? Do we have details in the process yet? Probably not, right?
We don't have the specifics, but my understanding is that if you're on a brand name, you'll get a communication from Canada Life once we start with a new provider saying, if we know that you're on a brand name, why are you on a brand name? Please provide information, and please get your physician to fill out this information, like a form or something like that, and saying why you need the brand name and not the generic substitution. So there's going to be protocols in place, but there's going to be some communication with members individually and their doctors as well about that.
All right, friends, we're going to have to end it there for today. I want to thank Stephanie for putting this together. And friends, I know this is important information. You have many unanswered questions, well, answers that left unanswered right now. So we'll try to get as much information we can from the employer, even we have questions. But the whole point of today was to mention that we have done some improvements, and there's still many improvements that are needed to be done to the plan to get it where it is. I think we can all agree that it's not where it should be, but we're happy to know that incrementally we're making that difference. Next up is a dental care plan. We're negotiating that one as well, and we are at the table, so that's good news. Stephanie, any closing comments for you?
I think that's everything. But if you do have questions about the plan, you can always reach out to our Labor Relations New York email address. Again, we can't answer specific questions, but if there's just some general question that you're looking for some answers, then we'll do our best to help guide you.
And we will be posting today's presentation on our website. And I'll tell you what, we'll link to the changes as well, the piece back in August, so you can refresh your memory and take as much time as you need. On that note, friends, we'll wish you a great day and good day with the rest of the week. Take care. Bye-bye.